I want to say hello to everyone out there. A great study recently just put out by the Clinical Neurology and Neurosurgery. It's a study about groin pain. Now, the many years that I have been dealing with these particular conditions, I can tell you I could have written this study years ago, but it is so directly correlated with groin pain and inner thigh pain with those who experience chronic sacroiliac conditions. We are broadcasting live right now. I want to say hello to the chatters out there. Good morning or good evening. Let's go right into the study, and then I'll go over a little bit of anatomy. Then I'll explain some things that we can do to combat this problem. This hopefully will help hundreds of thousands of people out there, but this is something really important. This you're going to like. So bear with me. Let me see if I can get things moving on here as we can go right to the study. Let's see if I can go right on my display capture here, and I believe here we go. Okay, you can see here, this is from the Clinical Neurology and Neurosurgery, just like around the corner, just like a few days ago, volume 161, October 2017, pages 104 to 109, groin pain associated with sacroiliac dysfunction and lumbar disorders. As we skim through this article, I will not go through it completely, but I will put it up there so you can look at it. Obviously, they evaluated sacroiliac joint dysfunction, lumbar spinal stenosis, and lumbar disc herniations. And from all the findings, 7 to 8 times more prominent was those people who had sacroiliac problems were more commonly known to have groin problems. This is the study right here. As you can see here, I'm not going to read every little thing, but basically what they're saying is they evaluated the groin pain with sacroiliac joints, spinal stenosis, as well as lumbar herniated disc or lumbar disc problems. They evaluated 127 people here. And obviously, as you look down here in the results basically show that 46.5% of the patients with sacroiliac joint dysfunction, 6.8% were lumbar spinal stenosis, and 8.1% was lumbar disc herniations, reported groin pain. Look at the significance of almost 50% of the people with groin pain is attributed to sacroiliac. So you can look at that study there. The conclusion, as I said right here, prevalence of groin pain is in patients with sacroiliac joint dysfunction was higher than those in lumbar sacral spinal stenosis or lumbar disc herniations. Now, none of these people did have hip disorders, so we can rule that out. So let me come back here as, hold on one second. I come back here and let's go right into the nuts and bolts here so we can explain a little bit about this condition. What can we do about it? Realize that we spend so much time in a seated position at our computer, in our bed, in our sofa, driving in our vehicle. The hip flexors have a big play in this as well, because hip flexors will throw the sacroiliac joint off, plus the fact that obesity, fat around the stomach, weak core, etc., etc. But let's go on as we can move through this real quick. First thing I want to go into is just give you an understanding about the old groin pain. If you look here, groin pain, I know what it's like. I've had this at several times from exercising, doing things, and I've always had a past history of sacroiliac problems, and most people who have low back pain have sacroiliac problems. As you look here, right up in here, the groin muscles, the most common, we have the adductor brevis, longus, magnus. Let's go up a little bit higher here. We can see the gracilis, where it comes really close up into the right in that inguinal region. The adductor magnus, longus brevis, the pectineus, way up there, very high up there. That's a real common muscle that's strained in that pectineus muscle. Those are our main adductors. These are the muscles that bring our leg closer to our midline. If we come here, we look at the sacroiliac joint. This is something really important. Understand a little bit about those sacroiliac joints. And I want to see if I can explain this a little bit better to you. I'll bring my friend up here again, and we're going to look at these sacroiliac joints. as you look here, here's our sacrum, just like you see right there. Here's our iliums. And when we walk, these rock back and forth. So generally what's happening here is they rock like this, back and forth, back and forth. Let me see if I get in the picture. This is how it rocks. So it's very common to see one pelvic sitting higher than the other. As I take you this picture right here, this picture shows you imbalances. Let me give you a few examples. Driving, sitting up on a wallet, carrying your purse or something more on one side of the body where the muscles, gluteus medius, starts to compensate. Doing a lot of work on one side of the body, like picking and twisting, maybe gardening around the house, doing things unilaterally, bowling, tennis, golf, anything you do unilaterally affects muscles to develop more on one side than the other, can throw the sacroiliac joint. Now, if you look at the sacroiliac joint where the arrow is going up, you see how that left side is higher. Well, right where the hip joint is attaching, the top of the femur and the thigh is attaching into the acetabular area, it's sitting up like this. Let me see if I get it right here. The left is sitting up higher than the right. So that means the left leg is higher up than the right. So when you come down and you stand, your leg length is going to become off. The purpose of correcting the pelvis is to get your pelvic back balance again. Because if your pelvis is off, everything above can become thrown off, like the mid-back, the neck, and you can actually have pain upwards in different areas because the body is compensating. So let's move up here into some very important stretches about the adductors. I think these are really good stretches, little simple stretches that we can work those adductors. If you look here, just kind of pivoting on one foot and leaning over. Okay. Here's another good stretching, just adductors, a little simple stretch, kind of like a sideways stretch to work those adductors. These are good stretches to get in the habit of doing. Here's a great stretch here. This is basically a lunge, but kind of like on an angle. You can feel the groin really stretch in that area. You can look at these instructions here on your own. I don't want to take too much time on that. Here is another great stretch. This is the most common stretch that most people will do with the adductors. A good stretch, you can just get on one leg and just slowly just let your weight bearing just glide on that muscle. Hold it there. Don't push too hard. You don't want to really tear that muscle or it's going to give you a lot of problems. Here's another stretch that I really love. This is commonly done in yoga, actually. This stretch here is just kind of putting your feet together and pushing your knees downwards. That's very, very a really good stretch that I highly recommend. When that pelvic comes off, those muscles start to, one side becomes contracted, the other side starts to stretch, and you get the whole kinetic chain that starts to cause that whole foundation of symptoms, which can be quite hard to sometimes diagnose. So I really hope that this will give you some insight. I really hope that this will help you. I want to say blessings to all my listeners out there. And if you are not a subscriber, please do so you can continue to get notified or get that little bell rung to let you know when we put out our new videos, which is quite often. Anyways, make it a great day. Bye-bye now.